The Mayo Clinic estimates about 1 in every 20 Americans has an autoimmune disease. They might be your family, your friends, your coworkers.
Yeah, there are a lot of autoimmune diseases, and one of our coworkers is opening up about his disease. It means you might not see him for a bit. Here's KETV News Watch 7's Bill Shammert.
You know, there's an old adage in TV, don't make the story about yourself. But today, somewhat hesitantly, we're flipping the script, all in an effort to raise awareness. I have a condition called Graves' disease. Terrible name, I know, but it's something as many as 1% of people have. That's 20,000 Nebraskans. So come with me inside Nebraska Medicine as I take a step forward in my journey.
Your thyroid gland is enlarged, as we know, based on the Graves' disease in our ultrasound.
Meet Dr. Jordan Brookhies, an endocrine surgeon at Nebraska Medicine. He says your thyroid is like a regulator for your body.
The thyroid gland is responsible for producing thyroid hormone, which has a lot of impacts throughout the body on metabolism.
But mine is, well, blotchy.
Your thyroid kind of has what we call a heterogeneous appearance, where there's sort of lighter and darker areas within it. A normal thyroid is typically all kind of the same color and brightness.
It is a telltale sign of Graves' disease.
Graves' disease is an autoimmune disorder where the body creates antibodies that activate the thyroid gland and tell it to produce too much thyroid hormone.
I was first diagnosed after routine lab work during an annual checkup. The symptom list was like a light bulb. Heart palpitations? Check. Weight fluctuations? Check. Sleep issues? Check. Mood swings? Check. And maybe that list sounds familiar.
By far more common in women, but certainly we see it in both men and women, and most commonly it's in sort of middle-aged individuals.
Blood draws are just part of the deal. My 5-year snapshot of thyroid levels reads a bit like a roller coaster. To control my Graves, I medicate. It's called methimazole. The dosage varies depending on where I'm at on the roller coaster.
The medications to treat hyperthyroidism come with side effects, and they can cause liver toxicity, and they can cause low blood counts, and other things like joint pain and rashes.
And that has me ready for a different solution.
Surgery is the most definitive option, so once the thyroid is out, the Graves' disease is cured. And so that's a great reason to consider surgery.
The need for a pill doesn't stop, but it's different.
The thyroid replacement medication that we put you on after surgery is actually essentially identical to what your body produces, so it's very well tolerated.
And of course, surgery always comes with risks.
The voice nerves that live near the thyroid gland, so injuring those is estimated at about 1 to 5%. And so when I operate on my patients, I use a nerve monitor to help identify the nerve, and we take great care to avoid injuring that.
So selfishly, I hope the vocal cords are okay.
I do too.
But for me, that risk-reward, it's worth it. So if you're someone with an autoimmune disease, whether it's Graves or something else, something invisible that you fight every day, remember, you are far from alone. I'm Bill Shammert. I'll see you in a couple weeks with a new scar and a new outlook.